Today's session is on biophysics. This is a topic for part 1 Mrcog candidates. So let's see and revise some very important points from biophysics. Biophysics is about the machines, the rays like the CT scans, the MRIs, the sonographies that we undergo, the radiotherapy, chemotherapy. So all these things and how they are useful and what are the side effects. Okay, so let's start with the commonest that we do every day, that is a scan or ultrasonography. So ultrasound waves are longitudinal compression waves with a frequency of more than 20 kilohertz. The frequency range used for medical imaging is normally between 2 to 15 megahertz. Okay, in obstetrics and gynac, this is usually 2 megahertz and 6 megahertz for abdominal and 7 to 9 megahertz for transvaginal ultrasound. Okay. There are various ways that an ultrasound wave can interact with the tissues, and what are they? One is reflection, one is refraction, diffraction, absorption, and scattering. So let's see what exactly happens here. So what is reflection? As the name says, the reflection occurs when a wave front traveling through the medium reaches an interface to another medium, causing the wavefront to reach into the medium from which it originated. So that's the reflection, right? What is refraction? Refraction is when a wave traveling through a medium reaches an interface with another medium and then passes through it, right? So reflection is, of course, when the wave is coming down and then returning to the same medium. So that is reflection. Refraction is when it is passing through the medium, but it's changing its way and goes to another medium. Diffraction occurs when the wave encounters an obstacle that has the diameter comparable to the wavelength. This phenomenon manifests in the apparent bending of the waves around the small obstacles and then spreading out as the waves pass through the small opening, right? Say, for example, the rays come inside the house through a small opening. So how they diffract when they come inside, like that. Same in that way, that is diffraction. What is scattering? So scatter is the combination of irregular reflection, refraction, and diffraction. So all together, and they are going in multiple directions. That is scatter. And absorption is the direct conversion of one energy, that or here now the sound energy, into the heat as it travels through the medium, right? Now, what is ultrasound imaging, and what are the elements that are used? So let us go into the machine things, right? So ultrasound imaging uses the pulse echo principle. The probe consists of two elements. It has got a transducer and it has got a receiver. The transducer is made from the material that exhibit the piezoelectric behavior. Okay. The rapid application of voltage changes across the piezoelectric material, and that is used to induce the mechanical deformation, displacement of the surrounding air, and ultrasound waves. The signals picked up from the receiver are used to produce an image by converting the mechanical deformation into voltage changes, right? So let's go into the resolution part. The resolution is, of course, the ability to distinguish the two adjacent points from each other. So how good it is to visualize. So the most of the ultrasound machine can achieve a maximum of resolution of 0.3 to 1 mm. So remember all these points that I'm talking about are questions for your SBAs. Frame rate is the frequency at which the imaging device produces the unique consecutive images, that means frame, and is expressed in frames per second. Okay. Acoustic intensity is a measure of energy flux over a certain time period through a unit area. So the SI unit is watts per square meter. So that is the SI unit of the sound power. Okay. So the acoustic intensity, it is, what is acoustic intensity? It is energy flux over a certain period of time. Okay. The adverse effects. So of course, when you have benefits of something, of course you have the adverse effects of it too. And the major ones are cavitation, microstreaming, and heating from the ultrasound. So cavitation is production, growth, oscillation, and decay of the small gas bubbles under the influence of an ultrasound wave, whereas microstreaming is the formation of small local fluid circulation, right? So of course, as the name suggests, they make the same sense. So cavitation is the decay of the small gas bubbles under the influence of this wave, ultrasound waves, and microstreaming, as the name suggests, it is the small fluid in the circulation. And heating, as the name suggests, is if we use it for a long time, the sound energy gets converted into the heat and it causes burns sometimes. So that is heating. What are the safety protocols to prevent that? Recommend the use of thermal indices, which serve as a measure of tissue heating effects. The thermal index must preferably be less than 1. So remember, the thermal index should be preferably less than 1, and the scanning time must be kept as short as possible. So these are the preventive measures to prevent heating. What is Doppler scan? So Doppler effect is based on the principle that the reflected or the scattered ultrasound waves from a moving interface will undergo a frequency shift. Okay, so that we generally call as a Doppler shift. So they will have a frequency shift. There are three types of Doppler technique. What are they? Pulse Doppler, power Doppler, and color Doppler. You must have heard all three of them. So what is pulse Doppler? Pulse Doppler allows a sampling gate to be positioned. So let me make it more clear for you. So it allows a sampling gate to be positioned over a vessel visualized on the grayscale image. The amplitude of the signal is approximately proportional to the number of moving red blood cells. Pulse Doppler provides information on the direction and the velocity of the blood flow along with the flow characteristics. Okay, so therefore it is angle dependent with flow perpendicular to the transducer being difficult to detect. So remember each and every word because all these are asked as questions. Now, what is power Doppler? Power Doppler is also known as energy on or amplitude Doppler. It allows the detection of larger range of Doppler shift and thus better visualization of the small vessel. However, this occurs at the expense of information on direction and velocity. The advantages of power Doppler include that it is not angle dependent, whereas we saw that the pulse is angle dependent, right? So it is not angle dependent. It has got higher sensitivity to detect the low flow or small blood vessels, and it has better penetration. Okay. So what have we seen up till now? That the pulse Doppler is better with the direction and the velocity of the blood flow and the flow characteristic. and it is angle dependent. Whereas power Doppler can see the small vessels, better visualization of all of them, but it has got it is not that good at direction and velocity or detection of that. But the good thing is that, of course, it has got better penetration and it can see the smallest blood vessel. What about the color Doppler? Now it provides the mean velocity of flow within the vessel by color coding it. The flow direction is assigned red color for flow towards the transducer and blue away from the transducer. Okay, so towards the transducer, so TT is R. So that's how I used to remember. And blue is going away from the transducer, right? So TTR towards transducer is red. Okay. Unlike power Doppler, color Doppler provides information on flow and velocity of the blood, right? However, this again has a problem of a poor temporal resolution, but this is again angle dependent. So the pulse and color Doppler are angle dependent. Only the power Doppler is not angle dependent. Now let's read about the radiation. You know that there are two types, ionizing and non-ionizing. The radioactive decay is the process by which an unstable atomic nucleus spontaneously loses energy by emitting the ionizing particles and radiation. It is impossible to predict when a given atom will decay. Okay? So the SI unit of radioactive decay is becquerel, and it is defined as 1 decay per second. Okay? And Curie is 1 Curie is 3.7 into 10 raised to 10 becquerel. Okay. Now, ionizing radiation. Ionizing radiation produced by radioactive decay includes alpha radiation, beta radiation, gamma radiation. The X-rays are a form of electromagnetic radiation with the wavelength in the range of 10 to 0.01 nanometer. They differ from gamma rays only in their origin, since the electrons emit them. A measure of X-rays ionizing ability is Roentgen. Okay, so for X-rays, Roentgen is used. One Roentgen represents the amount of radiation required to create one electrostatic unit of charge of each polarity in 1 cubic centimeter of dry air. Okay, just remember this unit. What is gray? The gray and rad are measures of absorbed dose of ionizing radiation. 1 gray is defined as the amount of radiation required to deposit 1 joule of energy in 1 kilogram of matter. 1 rad is equal to 1 gray. Okay. A measure of the biological effect of radiation on human tissue called the equivalent dose is measured in sievert units or Roentgen equivalent man, that is REM, which we commonly use. So remember, 1 sievert is equal to 100 REM. Okay, so all these are used for the ionizing radiation. The ionizing radiation threshold dose for fetal malformation. So these are all the questions that are generally asked. So I've kept a summary of them. So the fetal malformation can be caused by radiations of around 100 to 200 milligrays. Ionizing radiation dose for permanent sterility is 3,500 to 6,000 in men and 2,500 to 6,000 in women. Okay, so remember, for women it starts little early at a lower rate. Okay, so 2,500 it starts that early. For comparison, the absorbed dose of ionizing radiation from an abdominal X-ray is 4.2, and for chest X-ray it is less than 0.01 milligray. Okay. Now, what is ionizing radiation? It can be used for the management of both the malignant and non-malignant conditions in the form of radiation therapy, the radiotherapy that we use. Radiation causes DNA damage by direct indirect ionization of the atoms that make up the DNA chain. Now, this oxygen is a potent radiosensitizer, and therefore, the tumor cells in the hypoxic environments are more resistant to the radiation damage. So, remember, radiotherapy acts by causing the damage to DNA, and then uh, oxygen it acts as a potent radiosensitizer. So, the tumor cells in the hypoxic environments are resistant, and that is why we have seen that some tumors are resistant because of the cells don't have much of oxygen, and that is why they cannot take up the radiation for damaging the DNAs. Ionizing radiation is also used in the field of nuclear medicine, and the radioactive isotopes may be administered internally. So we know about all the different type of radiotherapies that can be used internally, sometimes brachytherapies, all those, right? Now, this is useful for both imaging, that is PET, and for treatment, right? So, positron emission tomography, so basically for diagnosis and for the treatment, like iodine 131 that we use for hypothyroidism, right? Now, coming to MRI, it relies on the fact that the spinning nuclei produces or absorbs the radio wave. Sorry for that. The frequency of these radio waves depend on the magnetic field that are in and their energy state. Within the MRI, a radio frequency transmitter is turned on briefly to produce an electromagnetic field, right? So this aligns the atomic nuclei within the body tissue, causing them to produce a rotating electromagnetic field, right? Now, once the field is turned off, this energy is dissipated to the surrounding lattice, and the nuclei revert to their original energy state, right? So once they come in the electromagnetic field and all of them they align, once we stop it, then they go back to their original state. And this time taken is called as the spin lattice relaxation time. Okay, so that is what we call as T1, T2 images. The fluids have long T1, while the structured tissues have short T1. So the fluids that we see in the T images, they require more times to come back, whereas the structured tissues have short T1, right? So once the RF fields are off, these nuclei cease to be aligned, and there is increased lack of synchronization. This is described by the spin relaxation time, that is T2. Now, what are the T2 images? Sorry, the T2 images. In the T2 images, you'll see that the water and the fluid containing tissues are bright, while the fat containing tissues are dark. And you'll see the opposite in T1, right? So the water and the fluid containing tissues are brighter in the spin relaxation time of the T2 images that we generally come across, right? Whereas the fat containing tissues or the structures will look dark there. The Tesla is a unit for magnetic field, that is the SI unit. Most magnets in medical MRI equipment produce a magnetic field of 0.5 to 3 Tesla. So remember these are the questions that are generally asked. Now laser. Laser is an acronym for light amplification of simulated emission of radiation. There are different classes. Class 1 is considered as low risk. They are low power devices emitting the radiation below the maximum permissible exposure. Class 2 is again considered low risk. These are low power devices emitting the visible radiation. Safety is normally affordable by natural aversion responses. Class 3 can be further classified as 3A and 3B. 3A is considered low risk but may be hazard if the beam is optically focused. 3B is considered medium risk, direct viewing may be a risk. Class 4 is high risk. These are powered devices with potential fire hazard, and most of the medical lasers are in class 4. Okay. Most commonly, the laser is in medical is the Nd:YAG laser that we use. This laser is commonly used for ablation of the fetal vessels in case of TTTS syndrome, that is twin transfusion syndrome. Carbon dioxide are also used for performing the cone excisions of the cervix and for laser ablation of the cervix. However, the CO2 lasers are unsuitable for operation through the thicker tissues. So remember, the CO2 lasers are generally used for superficial tissues like for conization, while for the deeper tissues we use Nd:YAG lasers because the wavelength is in the near infrared range because they have got more wavelength, right? Now, there are two types of diathermy, a very important topic which will be seen for your part 2 as well as for part 3. You should remember these, that there are two types of diathermies that we come across, monopolar and bipolar. Remember that monopolar can be used to achieve cutting, whereas cutting is not possible with bipolar diathermy. So you can do both cutting as well as coagulation with monopolar, but with bipolar you can do only coagulation. So it is safer, right? The bipolar one is safer. Both the techniques are used basically to desiccate the tissues. Now, bipolar is very safe. It is usually employed at the time of using the forceps. The current only allows in this diathermy, the current flows between the two forceps tips, right? And that is why there is no involvement of the patient. Whereas in monopolar, you have to apply the patient pad, and that is where through which the current passes through the patient, goes out to the pad of the patient, so that we use for the patient while using a monopolar diathermy, and that is why the patient is at risk here. The diathermy employs use of continuous and current low voltages, that is 5,000 to 1,000. This is used in laparoscopic surgeries for division, adhesions, and myomectomies, right? Um, the total tissue damage is less, so the smoke production is less. What is unipolar diathermy? It is once the device is applied to the patient, the current will flow from one point of contact and spreads out as it passes through the patient, heading for the return path, right? That is the monopolar one, right? Which is usually attached to the patient's thigh. From there, it returns back to the diathermy machine, so the patient is included in the circuit. This type of diathermy is most often used in the surgery, including the open, the minimal invasive, the colposcopy. So that is the monopolar diathermy, but try and use as less as possible. So this is taken from your part 2 material, and it is very, very, very important. So what are the safety measures to prevent the laparoscopic electrosurgical complications? Inspect the installation of your diathermy instruments before use. Use lowest possible effective power setting. Use the available technology. Near tissue response generators and active electrodes monitoring technology eliminate the concerns about insulation failure and the capacity coupling. Use low voltage waveforms for monopolar diathermy. Use bipolar electrosurgery whenever appropriate. There should be intermittent activation, so do not use it all the time. So use it and stop it when you don't want to use it. Do not activate in closer proximity with another instrument because there can be coupling, and ensure that both the heel and the tip of the bipolar forceps are under direct vision. So whenever you're activating, so that there is no uh, you're not touching any other organ or instrument. You should be sure of that. So these are the side effects of radiotherapy. You should remember the acute ones are epithelial surface damage causing mouth ulcerations, gastrointestinal damages causing the nausea, vomiting, abdominal pain, cystitis, fatigue, edema. The late ones are lymphedema, hair loss, further development of cancers and tissue fibrosis and infertility, right? So it can be gonadotoxic too. Now there are four different modes of ultrasound. So I just wanted to summarize this. There's A mode, B mode, real time, and M mode. A mode is when the echo is displayed in the form of deflection, that is a spike on oscilloscope as the ultrasound waves comes in contact with the various tissues. The size of the wave spike is related to the strength of the echo. It is rarely used nowadays. So A mode we don't use, of course. We generally use the B mode, that is the movement of the transducer yields a series of the dots which build the 2D images, that is the brightness modulation mode that we generally call. The real time again is also very commonly used. The transducer is moved automatically, either mechanically or via electronic means to generate the successive B scan, right? And M mode is continuous displacement of B scan with respect to the time. This demonstrates the movement, that is M mode, the time position mode. Okay. So this is me saying thank you. I hope you have liked this session. This was just a summary of all the possible questions that are generally asked. This is a very small topic, a very small subject